Another aspect of the ECG, which is usually looked at, are the intervals. But first, let's talk about the PR interval, between the P wave and the start of the QRS complex, which is the time between the atrial depolarization and ventricular depolarization. A normal PR interval is between 120 to 200 milliseconds, or not more than one big box. A prolonged PR interval may indicate first-degree AV block. A short PR interval may indicate Wolff-Parkinson-White or WPW syndrome, which is a congenital condition caused by an extra electrical pathway. Next, we have the QRS interval, which is the ventricular depolarization. Now, a normal one would be less than 120 milliseconds, or less than 3 small boxes. A prolongation may indicate a right bundle branch or left bundle branch block. Looking for the QT interval, this is the time from the beginning of the ventricular depolarization to the end of the ventricular repolarization. As for the normal QT interval, it varies and depends on the heart rate. However, as a rule, the T wave should end before halfway through the 2 QRS complexes. A short QT may be caused by hypercalcemia. A prolonged QT may be due to hypocalcemia, drugs like antiarrhythmics, and long QT syndrome. Now, I'd like to just touch on calcium's role during the electrical activity. During a myocyte action potential, calcium goes in phase 2, so if there is hypocalcemia, less calcium takes longer to fill and therefore elongates the QT interval. A condition called Torsades-de-Pointes means twisting of points is a feared outcome of QT prolongation and can result in cardiac arrest when using antiarrhythmic drugs, in conditions of hypokalemia, hypomagnesemia, and rarely from hypocalcemia. Long QT syndrome is a rare genetic disorder in which abnormal potassium-sodium channels in the action potential of a myocyte elongate and create a long QT interval. In this condition, there is usually a family history of sudden death or a young patient that frequently keeps passing out because of the Torsades-de-Pointes, and the ECG shows long QT intervals. Acquired long QT syndrome, where the condition described can come about, is by antiarrhythmic drugs, levofloxacin, Haldol, and many other drugs. Patients with congenital long QT syndrome must avoid all those drugs. T-wave prolongation may be from hyperkalemia and early ischemia. And U-waves, which are an upward deflection, have an unclear origin and can be normal but are also seen in conditions of hypokalemia. So there we have it. We're done with the basics, and I'm sure the next time you look at an ECG, you'll be a lot more confident with what you're looking at. But keep a lookout for our next video in which we interpret common abnormalities using what we've learned today. Keep watching sqadia.com and learn something new every single day.